During this video we will cover the basic anatomy of the pelvic floor, the jobs it does, and the importance of connecting your pelvic floor and your breathing. The pelvic floor is a large group of muscles which provide support to the organs that sit in the pelvis, such as the bladder, the bowel, the vagina and the uterus. They attach to the pubic bone at the front, the tailbone at the back, and sitting bones on both sides. It looks like a hammock in shape, and they wrap around your three openings: the front for urine, known as the urethra, the back passage where you poo from, known as the anus, and they also provide support and structure to the walls of the birth canal or vagina. The pelvic floor muscles help with bladder and bowel control and sexual function. Imagine the pelvic floor muscles as a trampoline made of firm muscle. Just like a trampoline, the pelvic floor is able to move up and down as a pressure absorber when we cough, sneeze, laugh, jump or run. The pelvic floor muscles create the base of the core muscles, which consist of the deep abdominal muscles found at the front, deep back abdominals, and the diaphragm, which sits at the bottom of the rib cage. Some of the factors which contribute to weakness in the pelvic floor muscles include pregnancy, childbirth, vaginal delivery, multiple pregnancies, genetics, ligament laxity, being overweight, and constipation. We're now going to explore how the pelvic floor muscles and breathing are connected, and this is important in helping to learn how to use your pelvic floor effectively. The pelvic floor muscles and the diaphragm work together as a team, like a piston, to manage pressure inside your tummy, and you can see the example of this in the image on the slide. As you breathe in, your diaphragm flattens, your rib cage and your abdomen widen, your lower core tummy muscles relax, and your pelvic floor muscles lower to make space for the abdominal contents to move down. As you breathe out, the diaphragm domes back up, the abdomen, the rib cage move back inwards, the core tummy muscles tighten, and the pelvic floor muscles contract and move upwards and forwards. This is important to know and practice, as it allows us to understand why connecting our breathing and pelvic floor muscles together helps not only in strengthening but also in daily activities. If you're someone who knows that you have a tendency towards holding your breath, breathing up in your chest instead of using your diaphragm, and sucking your belly in most of the day, these are all things that will limit your pelvic floor from being able to work effectively in partnership with your diaphragm and result in no piston action. Using this technique in your daily activities, such as bending, lifting, pushing and pulling, standing up from a chair or carrying your shopping or children, will help to manage the pressures that build up in your abdomen, and this will result in less pressure acting downwards on the pelvic floor, and then this in turn will lessen episodes of incontinence, prolapse and perineal heaviness. An easy way to remember this is with the term blow before you go. So this just means exhale or breathe out and gently draw up your pelvic floor muscles as you take the weight of an object or when beginning a task like pushing, lifting or bending over. Ladies, also remember, let go of your tummy muscles. Try not to hold your tummy tight all day long, as this really does limit the effectiveness of your pelvic floor and your diaphragm working together. The pelvic floor muscles are a large group of muscles whose job is to provide support to organs which sit inside the pelvis. There are many factors which contribute to pelvic floor weakness, and you may find you have more than one contributing factor, which is very common. The pelvic floor and diaphragm are an important duo. They work together in a piston action to ensure that the pressure which builds up in your abdomen is well managed and connect your core muscles to work together. Remember the phrase blow before you go. Exhale and lift your pelvic floor muscles. This will help to remind you to connect your diaphragm, pelvic floor and core muscles before any strenuous tasks, such as lifting, bending or pushing, amongst many others. And also, very importantly, let go of your tummy muscles.